Hello, I'm Dr. John Harding. I'd like to welcome you to our program this evening. It's childhood allergy. Our guest this evening is Alan Harris. Dr. Alan Harris. Welcome, Alan.
Thanks very much, John. It's a pleasure to be back here.
Good to have you back. We did toddler allergy the other time, and we're going to do the school-age child tonight, which is roughly age 4 to 9 that we're going to be focused on. We're coming into an allergy season pretty soon. We're into early spring here as we're doing this program, and I see a lot of allergy in primary care pediatric practice, and just see it too in everyday living. It's just very, very common. I see numbers like half the world is allergic to something, so you have picked a good specialty, I think. And I think the first thing we want to talk about tonight is the definition of allergy. I took a swing at it last time with toddlers, but I'm going to ask you to give an expert definition of allergy tonight, if you would.
Well, the expert definition is the same as your definition, which is an altered reactivity, which involves the immune system. And our immune system will take various innocent substances and react to them in an altered or abnormal way to create various illnesses such as hay fever or allergic rhinitis, asthma, sometimes eczema, penicillin allergy, bee sting allergy. All of these are basically harmless substances which our immune system processes or reacts to in an altered or abnormal way. And you said that this affects 50% of the population, and it is very common, but it's really more that 20% of the population will have some form of allergic disease or illness, either hay fever, which is the most common, which is called allergic rhinitis, or asthma, eczema. Those are the most common of the allergic diseases.
Probably like 20% that it's significant enough that it interferes with their life, they have to do something about it. I think a lot of people, I don't think of myself as having allergies, and yet I know if I'm cleaning out the cellar or the garage and the dust is flying, I sort of, and I know there's a family history of allergy, but common. We'll settle in.
It is, all right, it is common. And that's an interesting point, because some substances will react both to irritate and cause sneezing, such as a large amount of dust or pepper, which is sort of a classic, and that's actually not necessarily an allergy. An allergy involves a very small amount of a substance. I have a diagram here which shows substances such as pollen, which at some times of the year can be in fairly large quantities, but this could also include animal dander, dust or molds, will get into our system, usually through the respiratory tract, and then in an allergic person, in a person who has a tendency to develop allergies, and this is something that's inherited, and this is where that 20% figure comes in. 20% of people will inherit a tendency to make this altered immune reaction. These people will start to make antibodies. That's what these little molecules are, these little pictures are. And eventually, these sort of come around. As you can see, this is a circular picture. These will come around to haunt you. These will come back, and these, which usually protect us in this altered way, will now actually create an illness. And that illness, in this case, is hay fever or allergic rhinitis, where the person...
And rhinitis, the nose.
Right.
Allergy of the lining of the nose.
Rhinitis, right, exactly, means inflammation of the nose and involves the nose. And most people know this as hay fever. Some people, some older folks might even call it rose fever. But in fact, it can be many different substances, of course, that cause it, and that's why we like to use the fancy medical term, allergic rhinitis. So these come back, these antibodies come back and create a reaction which involves, in this case, the sneezing, runny nose, itchy, watery eyes that many of us are familiar with. And we may know that it's dust when you're sweeping your garage that is setting off these symptoms, but we may not at all be aware that this complicated immune process is going on to create some of those symptoms.
You know, I think we wanted to talk in some detail tonight about respiratory allergy, and we started with the nose, the allergic rhinitis. And I don't know if the rhinoceros got his name from the medical or the medical stole it from the rhinoceros, but you might remember rhinitis in the nose. We see this. We're talking about the school-age child tonight, and I think it becomes a little bit more clear now at this age. We hinted the baby sometimes, even if there's a strong family history and the baby starts off even in the first few months of life being stuffy-nosed, and it goes on and on and on, we start to get a little suspicious. By toddler, the 1 and 2 and 3-year-olds, you're maybe very suspicious or maybe even fairly certain that this 1 or 2-year-old has allergies. They've had a couple of wheezing attacks, they've had a few sinus infections, they've had a lot of upper respiratory infections, probably or possibly, you know, instigated by kind of continuous allergic problems.
It's a very good point, because it actually takes time to develop that immune reaction that I was just describing. And that time may be a number of years, perhaps in some instances only 1 or 2 years to develop the allergic symptoms. In other cases, it may take 6 years, 10 years. You know, even adults may first develop allergic symptoms. They've always had that tendency, to make that altered immune reaction, but for some reason it takes a prolonged exposure to this substance. And we're learning more and more about how the prolonged exposure or the repeated exposure to pollens, the prolonged exposure would be to dust or animals, creates the allergic response and then the allergic symptoms.
You know, I wanted to, we're now in the child stage, and I see in practice that it's fairly easy to be very suspicious at this age that from the past history that the child has allergies. We see the nasal allergy to the different common things, the pollen, the dust, the dog or the cat, the cigarette smoke. We see some croup, which is a little bit lower down than the nose, the larynx, the voice box where we get hoarseness, or the little kids get croupy attacks, a little further down trachea, the larger tube, and they'll get a certain type of cough, a real honky cough, a tracheitis type of cough. But I wanted to get into asthma tonight. We did touch on it in the last program on the toddler, but it's quite common in childhood. I think it's definitely very clearly diagnosable. And I'd like you to just, you know, I guess define asthma and go into a little bit about how you make the diagnosis, and then we'll get into the management and the treatment involved. If you'd define it and tell us how you diagnose asthma in a child.
That's an interesting question. It seems like a very simple one, and sometimes it is fairly simple to define asthma, which is wheezing or coughing which occurs episodically in an individual. But many times the definition becomes more complicated when the symptoms are only involve coughing or the wheezing is very intermittent. But basically the process in asthma is the same regardless of what the symptoms are, and that process is in the lungs, and I just happen to have a picture of the lungs. And we're talking, of course, about allergies and the respiratory tract and the airway. And these are the 2 lungs, and I don't know if you can see, this is the upper airway, or the trachea that Dr. Harding was referring to, and it branches into many smaller airways. And what happens in asthma is these smaller tubes or airways become inflamed, which is to say swollen with mucus production and very irritable. So these airways are the ones, these smaller or middle-sized airways are the ones that are involved with asthma. And as you can imagine, when many of these small air passages become narrowed, one has trouble breathing. And that's a very unpleasant feeling. And coughing may be the first sign of that, with some mucus production with the cough. And then the trouble breathing may go on to a sensation of tightness in the chest as these airways become narrower. And we then hear wheezing, and that's a cardinal or very clear sign of asthma. And that's basically the process. There are many different causes or triggering factors for asthma. The underlying cause is one that we are still researching and still trying to understand. But important factors are allergies that we've talked about, especially dust allergy, where we have a chronic exposure, someone's breathing in dust, and that immune response creates in the lungs this congestion and inflammation. But infections, virus infections, colds, will also tend to trigger the congestion and inflammation in the lungs. Cigarette smoke is one that you aptly pointed out is a very important one in today's society. Even, obviously, you don't need to be a smoker. The kids in any age group who are exposed to their parents' smoke are more likely to develop asthma. And if they do have asthma, are going to have more serious problems with their asthma, as well as other respiratory problems because of the smoke. Other air pollutants, of course, can tend to trigger asthma. Exercise, cold air, the list goes on. There are a variety of different things that will create and aggravate or worsen this inflammation and congestion in the lungs in asthma.
Now, I think the diagnosis of asthma, I know, and of allergies in general, involves, I know you do skin testing as a part of the diagnostic workup. I'd like you to comment on that. I'd like you to comment a little bit on blood testing, because I know that's done in some workups by some people. And I know you take the history and the family and the genetics is important. And I know you take a good environmental history to kind of give you some, I think, probably confirmatory evidence if you suspect something and then it's there in the environment. Could you just talk a little bit about your workup when you do see a patient that the question is asthma, a child with possibly asthma?
I'll talk about both asthma and allergic rhinitis because there is often a lot of overlap between those two conditions. But the most important thing, as you said, is the history. So we may have a child who develops symptoms of wheezing or coughing, which would be the asthma, or just sneezing or runny nose, which would be the allergic rhinitis, every time this child is exposed to a cat. And sometimes it's very obvious. You're visiting, grandma's cat, and the child develops the runny nose and the sneezing, starts to cough and get tight in the chest. After you do this for a few times, you learn that this is an allergy. Sometimes when you're living with the cat, you're living with the dust, you're living with the cigarette smoke, it's not quite so obvious. And that's where we get the information, the history of what is in the environment that may be causing allergic symptoms. And then we can confirm this or elaborate further on this with tests. And the most accurate test that is available to this day, and this test has been around for approximately 90 years, so it's been around for quite a while, is the skin test. It's been refined.
Is that longer than both of us put together, I wonder?
I hope so. And the skin test is one that some people may be familiar with, but basically